Hello, everyone. Welcome. Thank you for joining us today on this episode. Shaun Brewster and Bodine Ledden here with you again. Bo, today, our topic of a discussion, this will be a controversial one for sure, which is, does massage reduce the risk of injury?
Yeah, will reduce the risk or even prevent injury. And, I just did a quick Google search and looked at all of the blogs that come up or different websites or clinics that will suggest that this is a reason for getting a massage to prevent injury. And it's just not supported by evidence. We look at, well, do we even know can we reliably predict injuries? Well, no, we can't. So if we can't predict injuries, how can we prevent them with manual therapy? I think there's a lot more to the story.
I'm going to throw a little question at you here. So we say that we can't predict injuries, but there are a number of functional assessment procedures that we can use and strength testing that we can use that would say that this person has a predisposition to certain injuries if they participate in certain activities, which is not necessarily a prediction of injury. It's highlighting the potential for or a greater potential for injury if somebody were to do that particular thing. But then if we take that as a concept and say, well, we'll use massage to reduce the risk of injury, how can a passive intervention like massage, which we both believe to be a valuable modality, let's not get it wrong, um, can then change the risk of or the potential risk of injury for someone who has a strength deficit, as an example?
Yeah, well, that's interesting, right? Because we've got to look at well, what does massage or manual therapy do, and what are we proposing that it does? Because they can be very different things. We can use manual therapy or massage to reduce pain, but it's not going to change the function of the muscle or the structure of the muscle or connective tissue. So can we use it for pain reduction and improving maybe uh, someone's mood or decreasing stress and anxiety that may be associated with increased risk factors for injury? But we can't reliably predict who will be in pain. That's why we can't look at structure and say, oh, that person must be in pain, or they're likely to get pain because of that position that they're in, or the way that they walk, or the way that they run or lift, or whatever it may be. Because pain is more complex than that. And so it's difficult to say that, well, if you come in and get manual therapy or massage, then you won't get pain or you won't get an injury. You won't tear your hamstring when you play football on the weekend.
Yeah, that's a big claim, isn't it? That's a big
Yeah.
claim. Look, I think a good comparison to make here is between massage and taping. So we see taping a lot of the time, rigid taping used in sport in the prevention of injuries. Like they'll tape up a shoulder, will tape up an ankle, tape up a wrist or something, so the person then doesn't injure a potentially already unstable or whatever term you'd like to insert there joint. But the research on taping tells us that the tape itself doesn't limit the movement enough to prevent the injury. And what you're actually getting is improved proprioception, so sensory input from the tape. And then with that improved proprioception and sense of more stability, we get improved confidence. And so with improved sensory reporting and with improved confidence, which is a psychological state, not a physiological one, we then can participate in the activity with greater certainty, and people will charge into a situation where they're more likely to get injured, but knowing that they are protected by the tape, even though they're not actually protected, and come out with less injuries as a result of that. So the confidence and the sensation that people are feeling from the tape improves their performance to a degree and reduces the risk of injury. The stats show us that. And then if we look at massage in comparison, I think it's doing kind of a similar thing. The massage is not changing the structure of the tissues, is not changing range of motion capabilities or anything like that, the joints. All it's doing is giving the person a sense of less resistance to the activity. So if you do a gym session and you come out a bit sore and you go and have a massage, typically that reduces some of that post-exercise soreness. Not in possibly some of the ways that we previously thought worked, but you feel less sore because of you receiving a preferred sensation. Your nervous system likes the feeling of the massage. So you feel and therefore you move better. And when you move better, you move with more confidence and then you get less injuries. But the massage is not the reason you're not getting injured. It's because you're moving with more confidence. And there's more than one way to do that, of course.
Yeah, the perceptual effects are so important, and I love that example with taping. You know, improve confidence with movement. The perception that they are less likely to be injured can also be another thing. If they've had a previous injury in the past, it's a perception that they're less likely to re-injure that area. And so you think about the perception, and if anyone's worked with athletes or high performance sports, you know, it's highly valuable to have pre-event massage. Maybe not because it's reducing the risk of injury, but the perception that they are going to improve their performance because they have a better sense of feeling. They have that short-term reduction in the sensation of stiffness. And remember, these are sensations and perceptions. You know, they have the short-term increase in range of movement. And again, that is a short-term change that we see with manual therapy. We can't use manual therapy or massage techniques to create long-term changes with a short-term treatment approach or intervention. So these things can be useful in preparation, but that doesn't necessarily mean that it will prevent them from having an injury or decrease the risk or decrease someone's chance of having pain.
That's right. And I think this is where, especially to the layperson, where the definition of terms is confusing a lot of people. So we think about massage typically in the general public as a relaxing, enjoyable experience. Now, if you're about to go and play sport where your risk of injury goes up compared to day-to-day life, then the last thing you'd want to be doing is running headlong into a tackle, feeling all relaxed and chilled out. And so massage in itself is used in different contexts. In the pre-event sports setting, it's used, the techniques are typically prescribed to be stimulatory, increasing neurological responsiveness, increasing blood supply, increasing all of these. It's about raising the responsiveness of the physical body. Now, you can't replace a warm up with massage, nor should you, but the sensation that you receive from a very stimulating massage feels somewhat like a warm up for physical activity. So I think the perception is this is a nice lead into my warm up, and then I should go and do my warm up. The problem exists where people go, I'm late for football training. I'll jump on the table. The sports trainer can rub my calves out. There's my warm up done. Off I go. Oh, why did my calf tear? Well, you replaced it with something that was inferior. You need to actually physically move the body, change the length of the tissues, warm up the tissues. You need to run around to be able to warm up. The massage gives you the preparatory sense of those physiological changes taking place, but it doesn't replace it. And so there's massage that can be stimulatory, there's massage that can be relaxing, but it never replaces the actual physical activity, the physical preparation for the sport, the activity.
Yeah, and that's interesting as well. Like, yeah, the different approaches, pre-event massage, post-event massage, and then you've got recovery massage, someone that might come in for a recovery session. So let's think about this. Are we really promoting recovery of the tissue? Because, you know, sometimes there's these narratives that are thrown around that it's giving a good flush out of the toxins, or it's promoting increased blood flow. Well, it's not actually going to change the structure of or improve the recovery. In fact, if we were looking at flushing out any toxins or anything like that, well, that's probably actually going to increase the inflammatory responses with a massage, particularly a heavy deep tissue massage. So you got to think about it like that. But we know that people often feel a lot better when they're presenting with delayed onset muscle soreness, for example. So perhaps it's about changing the perception, promoting increased relaxation that can then improve their sleep. Therefore, they recover better. But we're not actually going to be changing what's happening to the muscle really with a manual therapy approach, as opposed to decreasing their pain and sensitivity with those short-term changes in improvements in range of movement. The real recovery and the best approach to decreasing the risk of injury is things like good hydration, good nutrition, good sleep, decreased levels of stress. And if massage or manual therapy can help to influence that, then that can be helpful. But I think it's difficult to say and probably not quite accurate to say that massage itself reduces or prevents injury.
Yeah, it's all of those. additional things that work systemically on the physiology and the psychology of the person. And then you've also got, of course, increased tissue capacity through exercise and strength training. Like that's really when you've got a healthy system and then you've got a tissue capacity that is progressively increasing with the demands of the activity, then you've got true injury prevention or at least reduction of injury likelihood. And that has nothing to do with any passive intervention. But I'm going to throw in a question. This will be devil's advocate question because there'll be people listening to this who play sport. And I'm in Victoria, and this time of year it's all AFL. And everybody who's in an AFL club, whether it's a local one or at an elite level, are going midweek to see their sports trainer, their massage therapist, someone to get their legs rubbed out, their hips, their lower backs rubbed out because they feel stiff and sore from the training and from the game on the weekend. And immediately after that session, they feel better. And they're going, well, what are these guys from race talking about? If it doesn't change anything, why am I feeling better? How would you answer that?
Oh, 100%. And I think that's it's highly valuable. But excuse me, I think that that's a perception as well. It's highly valuable in the psychological aspects of recovery that those 1%ers, it's like having a sauna or an ice bath or a massage. They are passive approaches to recovery. There's also active approaches to recovery as well. And so, yeah, I think it can be really valuable for the short-term reduction in pain, reduce perception of soreness, reduce perception of muscle tightness and muscle stiffness and so on. But I think if we just said massage in isolation, as opposed to looking at the other modifiables, training load, training volume, intensity, the sleep, hydration, all of those other factors that I mentioned before, those are the ones that are really going to influence the changes in or decreasing the risk of injury. Massage can certainly help with all of that, but in isolation, it's not something that we could point our finger at and say that will reduce your risk of being injured or reduce your risk of being in pain.
Because by and large, the effect of a massage is a sensory experience that changes our sensory perception of what is happening in our body. Like you said before, it doesn't change the structural function of muscles. It doesn't change the position of joints. It doesn't change the way we load our tissues. It changes the way we feel. And I think we're both agreeing here, it's how we feel is hugely important to how we perform. And then if we feel better, we perform better, then we are less likely to get injured. But it's not the massage that's doing that. It's the way we feel. And there are 1,000 ways to get to that point. Active recovery in cold water for one, compression boots. There's like 1,000 different ways to get that same kind of sensation of improved feeling within our body. And then it comes down to you don't need massage, you need something that makes you feel better. Let's explore some options. And it doesn't have to be me that helps you get that.
Yeah. Look, I've competed in high performance sport. I've worked in high performance sport, and I've done all of those things that you just mentioned. And for the reason that it does give you that feeling that you are doing something that may help your performance. But I think what we see in social media on the internet is that if you do this, if you come in for regular massage, you are likely to not get injured, and I don't think that's correct. There's so many other modifiable factors, but I also think that using massage and manual therapy can be beneficial in the overall scheme of things, but not in isolation to reduce the risk or prevent injury or pain.
And then if we extrapolate that out, you could argue that it does reduce the risk of injury by reducing your physical and psychological inhibition to going and doing the training sessions. If you feel better in your body, you're more likely to train regularly and consistently, and then that is more likely to reduce your risk of injury. And so you could argue, well, massage is actually helping you reduce your risk of injury, but it's really the training at the end of the day that is doing it.
Yeah, potentially, but then it's sort of what's making you feel like you need that as well. Is there is the training volume, intensity, frequency, rest, recovery, all of that, is that something that needs to be modified? Is it nutrition? Is it hydration? Is it work stress, life stress, environmental factors, all of these other things, because when we look at pain, it's complex, it's multifactorial. Um, so yeah, it's difficult. We've got to look at it from a very broad lens to understand that. Because again, we can't really predict who is going to end up with arthritis, who is going to end up with a hamstring injury, who is going to end up rolling their ankle. Some of these things just happen. Uh, and especially with acute injuries that we do see in sport, like if we've said if you come in every week and you're less likely to get an injury, and then you roll your ankle, you go, oh, not much you can do about
That's right. And look, I think we've talked about it in the context of sport, but this happens in general clinical practice too, not just for athletes. This idea, this messaging that our professions are perpetuating, which is you need to come and see me regularly for treatment so that you don't have pain. Like it's not just about injury, it's also about so that you can prevent your back pain coming back, so that you can prevent those tension headaches, so you can prevent those whatever. And you need to come and see me regularly for that. And this is we've spoken about this before, Bo, but this is a dangerous messaging. It reduces self-efficacy of the patient. It puts reliance on the therapist, which then reduces ownership of the robustness, the health, or whatever word you want to use of the patient, and sets them up to have this true reliance on you as a health practitioner, which is not founded in fact, truth, science at all.
that.
And it's going to be a short-term solution for a problem that you're creating as a long-term issue.
Yeah, I love this example because you think about your classic, your stereotypical sedentary person may have chronic pain, myofascial pain. They come in weekly or regularly for a treatment because that's what helps to decrease their symptoms. But then we could also say, all right, well, what else could we look at? Are you doing a minimum of 150 minutes of moderate level activity per week? Because that is also a way to decrease your pain and the numerous other things that go with exercise. And so you look at someone like that and you couldn't say, well, if we just keep rubbing away at the tissue, then that's going to stop you from getting pain, because we know that it's just not that simple. We've got to look at those other factors. How well are they sleeping? All of those things that I mentioned before. How much are they exercising? So I think that's really important. And I don't think that we should be pushing the narrative that we should be relied on to stop or decrease the risk of someone's injury or pain. I just don't think that that's very accurate.
No, it goes against all of the principles of healthcare as well. Like the underlying principles we're taught, at the start of our degrees or whatever, is like, you don't want to build reliance of the patient on you and so on. And I think every time I've brought up this as a concept that we don't want to encourage the rotating door of the same patients through your clinic every week and coming back. And I always say, build self-efficacy in the patients. Don't have them rely on you, regardless of their source of pain. There's something else that can help them. I invariably get the same responses from people, which is yes, 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 fantastic. And then there'll be another subset of people that say, I've got a patient, 5 patients, whatever, who have got these chronic degenerative diseases, problems there's no known cure for, and they come to see me on a regular basis. And that's the thing that they say keeps them going. That gives them a period of a day or two where they feel a bit better, and that's a reprieve and a real kind of respite from their ongoing debilitating pain. And so without me, they would feel lost and they would feel hopeless. And you're telling me that I'm doing the wrong thing. No, we're not saying you're doing the wrong thing. We're saying that solutions for pain are many and varied. Massage or manual therapy can be one of those things, but it will only ever be a short-term solution. And so if somebody has, for example, chronic degenerative arthritis of a knee or a back or whatever it is, your manual therapy, massage, whatever modality, can potentially be a really good intervention for their pain experience, and a valuable one, and a reliably valuable one. It can work every time, or just about every time they can walk out. But it's the only thing as a health practitioner that you are prescribing to them that will help them with their problem. That's where I have an issue with it. It's like, okay, I'm going to build reliance on me. And you might not be doing this intentionally, I'm speaking to practitioners, but I think there's a real danger if you say that, look, I've got a hammer and so you look like a nail. So I'm just going to use this hammer and hit the nail until the nail, does what it's meant to do. Versus I've got a whole bag of tools over here that I can choose for you. And if I don't have the answer, then I need to direct you to somebody else that might have the answer. And that might be a nutritionist. It might be a sleep professional. It might be someone who's going to work on your psychology. It might be someone who's going to maybe a pharmacological intervention. It could be anything. It's when all you've got is a hammer, everything starts to look like a nail. So this is the danger with building this self-reliance is what's your scope of practice and your scope of understanding. That shouldn't be the limitation for the patient. That's the key bit I think everyone needs to hopefully hear.
Yeah, yeah, that's right. And like we've said, that these aren't unhelpful interventions or treatments. In fact, I love to get a massage. I feel great. I feel like I sleep like a log. Um, it's great. But I don't use that in isolation. I make sure that I'm doing all of those other things as well. So I think that's important to get across to people.
Yeah, good. Well, hopefully we've not been too controversial in our opinions today, but hopefully they've been great. Well, I know for a fact that they've been grounded in science and real understanding of this stuff, and I hope that people listening can take it away and kind of go, okay, let's think about the messaging we're using because that's really the important thing. It's don't stop doing what you're doing. It's think about the messaging you're using when you're saying, here's why I'm doing this and here's how it will help you. Because we know that massage and all other modalities, manual therapy modalities, can be useful. They can be really valuable for patients. It's just about our explanations and the stories we tell around them. I think that's the important bit.
Yeah, agreed.
Yeah. Awesome. All right. Thanks for listening, everyone. Thanks, Bo. Great comments. See you all on the next one.
Cheers.